Good evening to all the viewers who are watching live and will be watching on the recorded version. Sorry for this delay as we were facing some technical issues. So we have wasted 18 more minutes and we do not want to waste your precious time. So let's not let's just not waste any more time and jump to the 30 seconds countdown time.
Good evening, everybody. And starting from day one, we are now in number 65, online CME live. We apologize for the delay which all of our esteemed viewers had to undergo, but this is all on the technical side. We are trying to interweave and interconnect and do the networking in a stronger way. Welcome tonight, sir, our President, Dr. Debnanan Kalyani, sir.
Good evening, Bidyut.
Good evening, sir. Somehow it got disconnected again. There are a lot of technical snacks. We have a very important and very interesting session tonight in this CME. With permission from our President, Dr. Kalyani, sir, I request our inaugurator tonight. With your permission, sir, may I request our inaugurator tonight, Dr. Austin Josti, who is the Deputy Medical Superintendent of National Institute of Homoeopathy and a very active person for the growth and development of NIH. We welcome you on the 65th CME platform. And Dr. Austin, the stage is now yours to inaugurate tonight's session. Over to you.
Thank you, sir. Good evening to all. It's a great privilege that I have been honored as the inaugurator in the 65th CME of NIH Alumni Association. Just to recollect my memory, it was in 2017 when Secretary Ministry of Ayush, Government of India, visited NIH and enquired about the participation and contribution of clinical knowledge by alumni of NIH. Immediately, the Alumni Association, which was already in touch with NIH for various activities, started contributing their experience gained in this homeopathic field by conducting the CME at NIH, and later on, if I am correct, it proceeded with an online CME. I am in regular touch with this Alumni Association member, and I have observed that till today, without any interruption, this CME has been conducted and is viewed in pan-India and globally. There is a huge response with very good feedback for the CME as the members are actively participating to listen the experience of the eminent practitioners and are keen to update their knowledge. The members are also very enthusiastic in sharing their knowledge which they have acquired through their clinical experience through this platform. So, on the 65th CME, I would like to welcome Professor Dr. Pannalal, former principal, Burdwan Homoeopathic Medical College and Hospital, to be the moderator of the 65th online CME. And also I welcome our speaker, Dr. Krishna Sudam Mukherjee. He is the ex-assistant to Honorable Dr. Bholanath Chakraborty and also a retired HMO of Government of West Bengal, who has a vast clinical experience. He will be sharing his experience on the topic managing case by evaluating the mental state of the patient. Taking mind is very important in our homeopathic system, and it's very difficult to select and convert to rubric. So I think that tonight's topic will share how to approach this in your day-to-day clinical practice. I thank the NIH alumni for their sustained efforts to conduct the CME, especially Dr. D.N. Kalyani and Dr. Bidyut Mukherjee for taking this as a continuous service for the benefit of the homeopathic system. Not taking much of the time, I am requesting and handing over to the moderator, Professor Dr. Pannalal to continue this section. Thank you. Hail Homeopathy.
Good evening, Pannalal sir. You are on screen live.
Good evening. Good evening.
Over to you, sir.
Good evening, Dr. Kalyani, Dr. Mukherjee, Dr. K. Mukherjee, and Dr. Austin, and other those who have joined to this particular CME. It is my great opportunity to have a can you hear me? Can you hear me?
Yeah,
Can you hear me?
we can hear you.
Can you hear
Yes.
me?
Yes.
Can you hear me? Hello? Can you hear
Yes,
me?
you.
Yes, we are hearing you.
Okay. Okay. So, I thank you, Mukherjee, Dr. Mukherjee, Dr. Kolkata, and his team to invite me in this particular session as moderator. And a very important thing that under discussion, that is managing case by evaluating the mental state of the patient, and and it will be presented by Dr. P.S. Mukherjee, who is my one of the best friend in Dependence. However, it is a very important. It is very important one in clinical practice, because we have to select a particular medicine on the basis of symptom similarity as per the homeopathic system of medicine. So in that, mental symptoms have a great importance in the selection of accurate medicine, either for the cure or even palliation of the cases. So, hello.
Hello.
We can hear you. Pannalal, we can hear you.
Yeah. একটু কিছু গন্ডগোল হচ্ছে মনে হচ্ছে নাকি?
No issue. We can hear you.
Okay. So we can start the session. The speaker, let him to talk about. After that, hello.
Okay. Thank you, sir. Thank you. Over to you, from Pannalal, sir.
Hello.
Krishna.
Hello.
Yeah.
Pannalal, sir, we can hear you.
Hello.
So.
Okay.
Already it is late, so it is better to start the session, and after that we can moderate that one.
Right. Over to you, Dr. Krishna Sudam Mukherjee, sir.
Thank you. Welcome to all. Good evening to organizer giving me chance to give some my sharing my experience. Respected seniors and beloved juniors and friends, I must confess and surrender to you all that I am not so-called academician or talented speaker and not dare to teach you something. I know you are far more better than me. I just want to share some of my experience after practicing homeopathy more than 40 years as and also private practicing and under guidance of Dr. B. N. Chakraborty. In this long journey, came in contact with many stalwarts, attending several seminars throughout the India. I should not boast or claim the procedure I am following is best, but it seems easier to me and the cure rate is better than before. In the topic, I have mentioned a term managing the patient by evaluating mental state. There are three things in it. That is one patient mental state and evaluation. Patient, we all know the sick person. It is having two stage, one relatively healthy stage and an acute morbid stage. Patients are coming in our chamber not during the acute attack all times, but in medium time when he is not so much sick. And when we are taking the symptoms at that time, his behavior, his attitude, his uh, gesture, posture is something different from the acute stage of the disease. Actually, we have to take that acute stage when he is suffering, so-called patient, he is suffering at that stage, how he behave, what he and what he says, how he says, and his and actually we have to let the patient talks in his own manner, style. We have to just listen carefully how he speak, what he speaks, try to understand why he speaks, try to feel the patient at his own way. We have to understand the concern of the patient, why he comes to us for treatment. Everybody is suffering some this and that, but everybody is not coming to us, coming to the physicians. But the patient when coming, he must have some concern. We have to think, we have to understand the concern also, because this concern, this attitude, this posture and gesture is definitely the individualistic. There's the very personal. It helps to individualize the patient. It helps you to know the patient itself. It is very important. During episode or acute stage, what he does, how he does, why he does, the keen observation and feeling the patient that helped me individualize the case easily. I have no such fixed pro forma or format. I am giving the patient to tell his story, and within this story or his speaking, I can guess all the sufferings and this. It is not that all the patient we should put in our format. We should not drag the patient in our format. So there are something we will miss. What the patient want to tell, that we will miss if we make that format only. Let the patient tell his a lot. But we must not, we should not be dogmatic. If we get the red line characteristic rare symptom must take into account, it is not that the thing, the all the mental state only we have to take it, but all we have to hear every sufferings, every his uh, pain. We have to hear all. We have to give patients listening. I hope you know what is hearing and listening. The difference between hearing and listening. Listening is the thing you should open your ear only. You hear everything in your mind, but don't uh, put your mind on that. Means you do not on your the sound you are taking, but you just keep patients listening what he tell and observe how he tell, what he tell, why he tells. Though the mental symptoms given priority in organon, but all symptoms taken together in judicious way, it will make totality of symptoms which represent the patients in its whole extent. Let me state that is a patient I am telling, a mental state. I am telling that the mental state is nothing but the reaction of the patient itself during sickness. uh, it is it is the how part, how he is doing, how he is making posture, gesture, how he is speaking, how he does things, how he get reliefs, what he does. This is the purely observation part. You have to keep your eye and mind always active at that part. You should not overlook or overhear anything. Hmm. Let me discuss one patient, then it will be easier to understand. One patient, aged about 52 years, is a tailor. He is saying, Doctor, I am having a problem. That's something coming down through anus during stool, which has to push back, we have to push back uh, manually after stool. Otherwise, it will throbbing and painful. I had piles with bleeding since few years, but when I take medicine, it will stops for few months, then reappears. Now they are telling for operation, but I don't want it. They are not sure operation will cure it permanently. It may recur. I have encountered some people who are having bad result after operation. I have inquired about you that you have cured some piles. Have you cured this type of case? Before that, have you cured this type of case? He is just challenging. He is just asking me like this. Have you seen this type of case before? Have you cured this type of case before? Then you try to, then you do it, or otherwise you leave me. I will go otherwise. That is, he is taking, asking for guarantee. If you can do, you have, if you have experience, then only you treat me. Usually patients are not telling like this. They are coming and saying They are not so much inquiry about the doctor, how he is taking, how he is curing patient. তার এলএম, হ্যাঁ, whether he will able to do it or not. He has inquired 2-3 days, and then he has come to me. This type of inquiry, this type of guarantee, there is that make the patient individual. How many patients is coming and telling you, yes, somebody is coming and they are different. Have you seen this type of case before? If you it, look, I can't make guarantee like that. In medical ethics, you should not give guarantee to any case. If there is, if you fail, if you can't make the medicine correct, then they will charge you. So you have to make some midway. I have told, look, I have seen this type of case. I'm not going to give you any guarantee of it. I will try. I hope it will be better. You can wait for 1 month. You take medicine and see for 1 month. If you will be better, you take. Otherwise, you won't. Patient told, I have heard homeopathy initially increase the disease, but if it is increased more, then I will be in trouble. Now I can manage somehow. That it should not be worsened. This type of case in this stage I can manage somehow. I am going to tailoring shop, sitting and doing, just pushing inside that what is coming out, then it will be relief and doing that. But if it is be more, then my all things will be hampered. I can't do anything, and the painful stage I can't be up. So if you can do it, if you give some assurance, then I can come with you. So patient itself, he is telling like that. Another patient, I'm just telling, I will tell you the medicine afterwards, how I manage the case. Another case, patient, 26 years, male. He is also having, I'm telling just 2 piles case only, and then otherwise there are several cases like this. The conversation, I'm telling the conversation, how they approach, how their position, how they make gesture. Another patient that telling, I have having bleeding during after stool. Suddenly yesterday, कल से अचानक मेरा bleeding शुरू हो गया and become very much weak. I have nervous. I have never had bleeding before. Don't know how it comes. Please do something. Why it is coming? Would you check it? अचानक ये ब्लीडिंग कहाँ से आ गया? Please do something. I am getting very much weak. I can't tolerate this bleeding. Have you any problem with stool before? I have asked. Occasionally, I have constipation and pain in anus, a swelling at the anus. It is going to aggravate when taking rich food. I have been asked for by doctor to avoid rich food. पहले से मेरा था एक स्वेलिंग सूजन था, इसमें स्वेलिंग था, लेकिन वो चल मैनेज हो जाता है, डॉक्टर के पास जाते हैं जब थोड़ा एग्रावेट हो जाता है तो थोड़ा मेडिसिन ले लेते हैं, वो थोड़ा कम हो जाता है। ऐसा चल रहा है। ऐसा डॉक्टर मना किया था जो ये मत लो, जो रिच फूड मांस ऐसा कुछ मत लो। लेकिन आप तो पता है ना, जो इनविटेशन है यह है, हमको कभी कभी ले लेता है। इट इज गोइंग इन द बीच में आई एम ऑल राइट, बीच में ऑल राइट, अचानक ये आ गया। I have been asked for by doctor to avoid rich food. Perhaps are telling that I have to go for operation. People are telling that I have to go for operation. Please, doctor, do something. I can't stand operation. Looks terrified. He calms that his look, gesture, and just his माने पाँव में पड़ जाता है ऐसा। ये थोड़ा हाथ पकड़ लेते हैं। जे प्लीज डॉक्टर डू समथिंग, शी इज बिकम सो टेरिफाइड। अटेंडिंग पर्सन जो था वो टोल्ड ही स्टॉप्ड टेकिंग फूड फॉर फियर ऑफ ब्लीडिंग। वो खाना बंद कर दिया। ही स्टॉप फूड इफ ब्लीडिंग विल कम अगेन। If a stool will come, then it will be bleeded. And so he has so much fear. Once he was unconscious before Tedbag injection. When he was taking, once he is telling us how he went for Tedbag vaccination. At that time he got unconscious. That's some, it may be some physical attack or fear, it may be. But this, in this case, this another thing that this attendance, the voice of attendance is also, the conversation of attendance is also important. Persons are telling during sickness, the attendant who are observing him, and patient when coming in our chamber, somewhat healthy stage, they are not telling everything during sickness, what they are doing, how they are become angry, and how they are behave. We'll get it from the observer, from the attender, attending persons. Again, I have asked him, are you obey the food regime? Instructorily, I had no problem nowadays. So taken some chicken in a invitation. But henceforward, I won't. सर ये तो ले लिया था, गलती हो गया, लेकिन इसका बाद हम नहीं लेंगे, आपका प्रॉमिस करते हैं। प्लीज चेक द ब्लड। The first case, again I am discussing, in the first case, as soon as the patient came to know about her condition by surgeon, that Piles case who is suspicious that time. As soon as the patient came to know about her condition by surgeon that he may undergo operation, he became afraid, and because he has a lot of scare that anything can happen, he very suspicious result of operation to various persons. So evaluating this mental stress on him, the concern, that the things coming, that fear injury, being injured of. Injury means nokshan. Injury means something will happen, nokshan will happen. That is fear. Fear, what is the difference between fear and anxiety? Fear means something, there is definite objects are there. In anxiety, it may be no object. Anxiety is a whole, just is a situation. Is a undermined, is a anxiety. It may be various things, no definite cause. But in fear, there is definite cause. Fear is a delusion and fear. What is the difference between delusion, fear? Delusion and fear is a future tense. Fear, it may happen. It may happen. That is the fear. It will happen. It is the fear. Fear of injury, being injured of. That is, he has some noksan, he has some pain, he has some something coming out, something noksan, something he can't tolerate. That is the injury. That again, more injury may happen. And patient is suspicious. He is asking everywhere what is to be done, how it is to be done, whether it will not be, it will be okay or not. And there is a fear of betray. कोई खराब हो जाएगा तो नहीं, कोई गलती हो जाएगा तो नहीं, ये सब fear betray. यदि कोई patient, if doctor will, doctor if can to treat this patient, can to treat this disease, if he knows how to treat, then only I will go. Otherwise, it may spoil my case. It is his mentality. So here is fear of betray. In fact, he didn't go for operation. There was no relief from physicians. He inquired everywhere where to go or not. He was in dilemma. He was in that is groping as if in dark. What is to be done? So are showing and indicate that Hayasamas and Hayasamas 6 in single dose gradually improve the case. And I should confess, along with it, I have given him for checking the blood Honb'le's Virginia mother tincture also. For a few days, when the blood is within 1 week, it has been calmed down. And there's some the things are coming down is 1 week, it is gradually lessened. He reported me after 2 weeks that it is the frequency it is coming, at the frequency it is coming, it is much less, it is coming slight, and automatically it goes inward. It is not to be done by manually. And after 2-3 months, after 3 months, it is mostly all right. And the second case I have taken that fear. That second case is also delusion injury. Delusion injury means this suffering, pain, bleeding, all are within delusion. Delusion means present. At present, there is suffering, pain, bleeding. Fear injury is also there. Fear operation. If there is some injury may happen. And fear dark. What happened? What happened? Suddenly, so blood is coming. What happened to him? He is in dark. Dark means he can't see the things. Patient is sometimes asking us. They are desiring light. Light means what? Light is, there are several meanings in light. Light means this sun ray. Light means the heaviness should be less. That is light by weight. When he wants to be light, he wants to be less suffering, less. He wants to suffer less. That is also light desire. In Repertory, you will see light desire is there, and in light desire is there are 17 medicines, and all the medicines are having different type of light desire. in fear of dark is also there, and this fear of desire light and fear of dark is coming all together mostly. Fear of dark, what happened? That is the fear of dark, and they want that do some examination of me, some blood test, some they are asking for blood test, they are asking for USG, there are several things. Please see what happened to me. That is the fear of dark. They want light, and there is some astonished, delusion astonished. Suddenly, how happened? अचानक कैसे हो गया? ये আমার হঠাৎ কি করে হলো? अचानक how he suddenly so suddenly I was already I was fine, but suddenly what happened to me? Astonished. Suddenly how happened? Cry for help. He पाव मेरा हाथ पकड़ लेते हैं. That is not cry in loud sense. His emotion. He's asking for help. That is the cry, inner cry for help. Please save me. The frivolous here is also that's he was casual. He was casual when he was suffering the first time. Doctors told him, "Don't take rich food." And taking medicine not seriously. He is when the suffering is more, he is coming to doctor and obey the regime. But when he is something better, he forget everything. That is the frivolousness. And the medicine is, that is the stramonium. And in stramonium, I have cured several cases like this fear, and there are various entry. One medicine having more than 100, 200 symptoms in mental stage also. So there are various various entry point for one medicine. It is not that everywhere you will get this fear, this fear of dark. There is in fear of injury. There are several entry points are there. There is affectation. They are telling that I will do this and that. So they are making story. But when the actual stage come, they are afraid. They are very much afraid. They are the फानुस होता है ना, जब पिन फटता है, फानुस फट जाता है, ऐसा तरक, उसका माने ढोल फट जाता है, तब इसका false courage. Is so man, so he is showing his courage. That is the affectation. And their observation I have seen, that terrifiedness, that terrify. That is the atonk ho gaya usko. The medicine is stramonium, and stramonium 6, and that is only taken 2-3 weeks time to stop the blood. Just within 2 weeks it stops, and gradually that swelling is also diminished, and after 6 months it is more or less, he has not come after that. After 2 years, about 2 years, he's fine. It is actually, it is not the thing to make rubric out of every word, but feel the patient and its situation, its circumstances. Then it will be easier to deal with. In this method, to thoroughly read the repertory of mind section, and it is a metaphor meaning. The rubric in the repertory is telling that is not one rubric has several meaning. In Bengali, one word giving several meaning. If we tell you Esho, Esho, it means come. And if you tell Esho, Esho means you go. So, in how you use that term, in one word, there are several meanings. In repertory also, in one word, there are several meanings are there. I've told you that in light desire, there are 17 meanings are there. If you open the dictionary, Webster or English to English dictionary, we'll get that word. You should consult the dictionary because the language is not our mother tongue, and there are many more things to know. We have to learn various things. We have to know the situation. We have to know the position, the application of verb, application of noun. We have to repertoire is written in English, and Kane and others, their knowledge is far more. They are American. So we have to learn the English far more, and we have to consult dictionary for meaning to study the rubric. One minute. হ্যাঁ, ফোন করুন, একটু ব্যস্ত আছি, একটু পরে করুন, আধ ঘন্টা পরে আমি ব্যস্ত আছি। Sorry. We should not make the rubric out of every word, but feel the patient and its situation, its circumstances. Then it will be easier to deal with. We have to thoroughly read the repertory of mind section and its metaphor meaning, which should be authenticated and clinically proved. In this context, I like to quote Dr. J.N. Kanjilal. He was an excellent prescriber and a strict classical homeopath. You know all of his name. Case taking is an art, hardly understood. It is to be learned and acquired by practice like any other art. Mental symptoms are never to be asked, but they are only to be observed. Be careful asking mental symptoms. It can expose you to misleading by patient. Wherever the patient says or does, they are all mental symptoms can be converted into the rubric of on mind. So, you see, it is not like that you have to take the mental symptom, mental case separately. If you know how to take, then you can easily take up the things. You have to know the procedure. I cannot see if mind does not know. আপনি এটা করতে পারবেন না, আপনার চোখের সামনে থাকলেও আপনি জিনিসটাকে বুঝতে পারবেন না, জানতে পারবেন না, if you don't know the things. Again, I must confess that I have sometimes using mother tincture of some medicines time to time in course of treatment, like Honb'le, Chelidonium, Genesia Oshoka, Karatigas, etc. When I seems it is to be required for application of using indicated medicine does not spoil the case, but help to shorten the distress of the patient. It is my practice. It is my own. In the practice, I have seen it. It is not like that you should follow it. But I have seen that it is helpful to me. For the treatment of the patient, I think a true atmosphere is needed to develop. A closed chamber and an antechamber is essential so that patient should feel comfortable enough and can talk freely. Doctor should behave friendly, sympathetic, that he can open her mind freely. Listen the complaint patiently. Examine the patient carefully. All these will make a report on the patient. Discuss the wrong things which should be corrected. Give support to the patient. To treatment the baby, you have to cautious and careful. Here the observation part is most important. In its appearance, look, fear, anger, restlessness, dullness, communication, or communicative or not, gesture, posture, etc. Everything will guide you to the medicine. If you know how to observe and what to observe, then evaluate it and convert to rubric. For selection, I am following synthesis, repertory, and a radar system. The medicines which are coming that should be matched with the case of the patient. Every medicine and patients is having the same core symptom. The essence of the drug and essence of the patient will be same. Once in a lecture, we have asked our great teacher, Dr. S.P. Day, the importance of repertory in selection of remedy. He told it's just a tool to select some similar medicine for the patient, but you have to make simillimum by the knowledge of materia medica to match the core essence of the patient. So the knowledge of materia medica, organon, and this repertory all together will help you to construct their solid base. In the last, again, I would like to tell that there is a huge scope if we study the materia media again in the light of mental state and gear up the miraculous effect of homeopathy so easily. This is my topic, and if you want to hear more case, then I can share another case. If you there is, I think there is time, or if you tell me, you please tell me what to do. Hello, Dr. Bidyut, Dr. Pannalal. Hello. Hello, am I audible? Hello. Hello. Hello.
Sir, please continue.
No, no. Hello. Should I
Sir,
continue?
please continue. Yes, please.
Okay. Okay. Thank you. A girl came 6 years, had a complaint of cough, diagnosed as bronchitis, 3 to 4 times in a year, suffering from obstinate cough. Antibiotics or cough syrup fail to cure cough, lead to breathlessness. Sometimes she has to nebulized in hospital. She came with her parent, looks pretty good. She is starting interacting with the patient in the room. I was overseeing this from my chair through glass. She was friendly body. I asked the parent when their turn comes, is she behaving like this always? Her parents told, wherever she goes, after a few minutes, she will be center of attraction. She is very good in making friends. I asked what she does during attack of cough. She won't lie in bed. She just hate to lie in bed. Remain same restless, not sitting in one place. I asked, what do you like? I asked the girl, what do you like? She replied, I like dancing and started to dance. Her mother tried to stop her. She bit her mother. Her mother told after she bites. After mother told she used to bite if we resist her against her will. So this is the case. Rubrics taken. The patient is so nice and talking to everybody and cheerful. He is having so much problem, breathlessness and this and that. Still, he is so hilarious, so vivacious. So the rubrics taken vivacious, and the observers taking, and I am also seeing, she is constant in move. She is dancing. He is fond of going here and there and movement, and never stops anytime. During attack, he sees want to see TV or playing some things, and talking, biting. So you can easily understand the medicine. That's the prescribed medicine is lachesis. Lachesis 30, followed by placebo. Cough reduced within a week, but exposed to rain after few weeks, and cough severe at night. But the mental state was as before, playing with TV and game. She was repeated another dose of lachesis 30, and then slowly breathing difficulty calmed down within a day. Then placebo continued. There was no episode within 6 months. This is the procedure I am following. But the thing is that the medicines, we have to know the medicines, the mental aspect of the medicines, the mental state of the medicines. We have to learn this. We have to learn the procedure objectives. Actually, we have visited several seminars about this since 2006. I am uh, within this procedure, and there are several friends of me here in Calcutta, in West Bengal. There are several districts in Midnapur, in Malda, in Darjeeling, in Coachbihar. There we are making seminars in Calcutta also, and within there is one um, HHF, one association in Bombay. Hmm. In Delhi also association is there, and actually we are having one association cultivation of homeopathic science and I was secretary of that. And like that, we are making several seminars here also. Uh, Dr. Ashok Kumar came here to teach us like that. He was a very good teacher. He just died last year in COVID. So this is the case, and if you want to know more, can ask me. And actually, I have first time I am giving. I am with you. I am not so much prepared, and I have got very less time. I was in Bangalore, I was outside of this state, something, and I got very much. And in the meantime, my wife got operated for cataract last week, so I could not make a good preparation. So if I get chance for the future, I'll try to present more good cases. Thank you. So it is the end. Hello.
Hello.
Hello. Please tell what should be it will be the lecture will be more better. Please give me some instruction or some comments. How it will be more emphasis. I think if it will be audio visual, then it will be more better.
Hello.
Hello.
Hello. Hello, Mukherjee.
Hello.
Huh? Hello, Dr. Bidyut Mukherjee.
Hello. Yes, tell me. I can hear you.
Pannalal, we can hear you. Pannalal, we can
Yeah.
hear you.
Yeah.
It's your turn to moderate now.
Yeah. Okay, thank you. Thank you, Dr. Mukherjee, for
Thank you,
nice
sir.
presentation of
Okay.
your cases and the evaluation of the mental state in respect of the particular cases. Now, in this respect, the topic was the managing case by evaluating mental state of the patient. Definitely, our management of the case means we have to cure the patient with the selected medicine, right medicine.
Yeah.
Yes. But in that case, what happened? You see, we need to collection of symptoms, as Dr. Mukherjee stated, and not only the physical, not only the mental symptoms, but also the physical symptoms. All the symptoms to be gathered together, either internal or external, starting from the mind, sensation, and to pathology. All these from general to particular, all the symptoms to be collected, and that symptoms to be gathered together and arranged in a definite fashion. They are to be logically combined in such a fashion so that it can produce a particular picture of the patient, particular portrait of the patient, so that on the basis of that portrait, we can search for a similar medicine in our materia medica, either In between, we may take the help of the repertory. So that is the process. That is the process. So in that, you see, mental symptom in that, this totality, when we are going to make the totality, we need all the symptoms. All the symptoms,
Actually,
not only mental symptoms.
yes.
Not only the
Actually,
mental symptoms, but all the
in my
symptoms.
experience, what I
But
have seen when I am taking those physical symptoms, yeah,
just a minute.
Okay, Mukherjee also.
in physical symptoms, when I
Yeah,
am taking that,
physical symptoms and the mental symptoms, definitely.
that most are coming for the common symptoms. That's burning, pain, smarting, burning, and this sticking pain. Those are coming through pies.
Okay,
That
Mukherjee.
is for ulcer and this fissure and this. That are mostly, whether it is normal, what is it? It is your normal symptoms, common symptoms,
You will
or
get the
real
answer.
particular.
You will get the answer. Let me proceed ahead. Ah, that is the way of selecting the drug through the totality. But to make a totality, it is very difficult. The first part is to get the
For
totality. First
individualizing
part,
the
the case
case,
taking, what you have
between
said,
the red or
the case
black.
taking, definitely that is very important. That needs practice, that needs
Yeah.
tactics, that needs intelligence, that needs knowledge of the entire system, that is a medical system, including materia medica, organon, and this your pathology, other subjects, practice of medicine. So all together required to have a good this your case taking in individual case. So after collecting all those symptoms, we have to make the totality for the selection of medicine. So in that state, we have all the symptoms definitely. But here in the totality, for the selection of medicine, the mental symptoms are the part. Mental symptoms are the part, not only part. They are the important part of the. They are the important part of the this your totality. As because mental symptoms are general symptoms, as because mental symptoms reflects the inner picture of the disease, inner man as a whole. You can say the direct vital force directly. So that's why Hahnemann as well as the other stalwarts games given maximum importance to these mental symptoms. Uh, uh, Sometimes these mental symptoms are not available in all cases. We, from our experience, we can say
Sorry, these
there are.
mental symptoms, if you know how to collect, sorry, if you know how to
Mukherjee,
collect,
please make Pannalal
patients,
complete.
mind is always with patient. Mind is not away from the patient. Mind is always with the patient. And if you know how to collect the mental symptoms, then you will easily find the how the posture, the mental state you will found.
Exactly. That
In acute
that
case
I told
also,
you, either the mental symptoms or the physical symptoms that included in
in
the case
acute case
taking.
also, I can show
So the
you there are
process,
several
case
mental
taking,
states.
case taking.
Mukherjee,
So
please make
case
Pannalal
taking, and
complete.
who is master in the case taking, he will be able to find out. He will be able to find out. He will be able to search out the mental symptoms as well as physical symptoms in the patient. As you have described, as you have presented your cases, how you have observed. And Dr. Kanjila said that observation, mental symptoms to be collected through observation rather than asking. That is very, very
Mental
correct thing.
symptoms should not
And
be
for
collected.
that, as because the that is collection of mental symptom is difficult. It is not possible for every physician. But an intelligent and knowledgeable and
If you know
tactical
the procedure, if you know the
physician
tactics,
can
technique,
find
I
out,
mean, if
can
you know the
collect all
technique,
these symptoms along with the physical symptoms. So, but there are cases But there are cases.
That's something. Hmm.
There are cases where there is very too few this year you can say mental symptoms, or where there is no at all, no physical mental symptoms. So in that cases it is difficult. Only the cases which are can be managed, can be cured, or can be palliated through mental state if the suitable mental symptoms or suitable mental symptoms are available in the case. But it is not the non-availability. I don't mean that it is the ignorance of the physician. Ignorance of the physician is always that is the defect. So a sensual, a sensitive physician, he must have the knowledge how to collect. He must have the technique how to collect, how to observe, how to interpret. And for that, the collection of symptoms is difficult. At the same time, that interpretation is also difficult. And most of the chronic cases, mental symptoms are sometimes remain latent, or you can say the patients do not care of that. So in that cases, it is difficult to go through the mental symptoms to make a totality. That's why Boning Hussain, he has given very least importance to that. He has given maximum importance to the physical symptoms, characteristic symptoms, with that location, sensation, modality, and concomitance. On that way, he has presented. But Dr. Kent has given maximum importance to the mental symptoms in the making that totality. Now, as evaluation of the mental symptoms, I am not telling about the collection. I am telling about the evaluation. That is giving importance of the particular collected your mental symptom. That I want to say. Collection is different. Observation is different. Knowledge is different. But you gathered all those mental symptoms. You have interpreted all those symptoms as you have shown your cases, as well as in your repertory writing, this your interpretation. So there you have, that is your technique, that is your intelligence, that is your knowledge that make you the correct collection, observation, interpretation, and its application in the case. Application. We are concerning with this sort of observation, this sort of or collection of symptoms from a patient. But it is true, all the cases are not presented with the mental symptoms. These are very difficult. And sometimes these physicians are not or ignorant about that. In that cases, it is difficult. So these are, in this case, it is definitely a difficulty in selection of medicine, assessing the mental symptoms. But where the mental symptoms are available, that is to be evaluated, that is to be given importance in the selection of medicines. Like physical symptoms, you see, like physical symptoms, mental symptoms are also different categories. Different categories. Mental symptom means it is important for selection. It is important for making the totality. That doesn't mean. There are many mental symptoms which are very, very common to the disease, which are common to the very common to the particular pathology, which are very common to the particular background history. So every symptom to evaluate for selection of medicine, for making the totality, each symptoms, either it is physical or it is mental. They are to be studied. Each symptoms to be studied in a way that is its origin, from where it is coming, when it is coming, his history, his progress, his direction, is this your that is extension, and associated with your what is called modalities as well as concomitants. Everything, everything, each symptom, whether it is physical or it is mental, those are to be studied, and then you can give importance. Then you can give this your in that totality. You can take it in that totality for the selection of medicine. Otherwise, a very common symptom, a patient who is suffering from a long time, in a particular case, he may be depressed. He who has lost his friend or nearest, he may be depressed. He may weep. Those are weeping. That's depression. That's sadness. These are general or common your mental symptoms. That's why each symptom, each mental symptoms to be studied from its in the view of its origin, its progress, when it started, how it started, what is the relation, particular relation with the patient state. In that state, how it is related, whether commonly related or uncommonly related. That is needed, whether it is physical complaints or related to the mental complaints. So there are certain mental symptoms which appear or associate with the particular patient as positive modality. As for example, disappointment of love, or this your some mental trauma, or fear, fright, long continued anxiety. They appear as the positive modality of the case. They are to be given importance in the selection of medicine, in making the totality. So in that way, every symptom to be evaluated. Every symptom to be like other symptoms, the mental symptoms. And sometimes these mental symptoms may be uncommon, peculiar, rare. As I have said, like the general, this your physical symptoms. There are very many physical symptoms are common symptoms. Here, there are many mental symptoms. They are common to the pathological state, common to the particular disease state, particular situation or circumstance. So, and one it is a particular symptom to be given importance, mental symptom to be given importance in the selection of medicine. We have to find out, we have to weight it, the individual mental symptoms, whether it is uncommon, peculiar, rare, or having the causative modality, or sometimes some mental symptoms appear as concomitant to some other complaint. These are very, very important. That way, if we evaluate the particular symptom. As for example, I can say that a particular patient who is very much irritable before menstruation. So that is a concomitant to the particular state. Concomitant to a mental symptom is concomitant to the particular state. It is having the highest value, greatest value. That is to be taken into consideration for selection as well as for the making the totality. So similarly, causative factors after fright, after fear, after disappointment, this your after long continued anxiety. So there are so many. If we go through the repertory, we will get and in the Mathematica, you will get large number of mental symptoms, act as causative modality in particular patient. So those are to be evaluated. Those are to be given maximum importance in the selection of medicine. So similarly, uncommon, peculiar, rare symptoms. That may be. That is a person, that is, in case of your lycopodium, that is weeping while thanks. Definitely is uncommon, peculiar, rare. It is not the causative modality, mental symptom, but it is not causative relation, but it is not concomitant relation, but it is the mental state of the particular patient, and that is uncommon, peculiar. Irritability is there, particular patient having the irritability, but not in all time or in relation to the this your situation, circumstances. Irritable when? In the morning after waking. It has the definite modality. So it is not a common one. Simply if you say irritability, the patient is irritable. That is the most common one. Unless it is modified by something, either circumstance or then if you have such type of this modification of the particular mental symptom, you must give that is uncommon, peculiar. And sometimes it is rare. Sometimes it is rare. There are so many symptoms. Just a minute. Quality modality. Desire to kill. Desire to kill. A barber wants to kill his customer. A barber wants to kill his customer. You see, this is very uncommon. This is a rare one. Impulse to kill herself. This is very important. Herself. The own life is definitely that is the we can say basic need of the person. Always any living body, living man or woman or living individual like to or try to save him. That is the basic drive. But he is going to or she is going to impulse to kill herself. So that is very important. So these are uncommon, peculiar. Desire to kill. That is uncommon. Definitely kill someone. That is definitely uncommon, but not rare. Peculiar. So in the differentiation, definitely 5 or 8 or 10 or 15 drugs are there, desire to kill. And if a patient having desire to kill herself or himself, then that will have the eliminative one. That symptom will be taken as eliminative one. So the weeping while thanks, fears to be alone because to avoid the risk of injury herself. He does not like to remain alone because if he remains alone, he will kill himself. This is very, very rare symptom, very rarely found in the patients and very uncommon, rare, strange symptom. But so these type of symptoms are very important. They want a moral feeling. That is an uncommon one, definitely. Restlessness. This is a common one. Suppose one is having fever. So along with that fever, he may be calm and quiet, he may be restless. But if you go through the restless, you will get the more than 100 or 150 drugs. More than that, more than 200 drugs. But it is difficult. These are not uncommon, but it is not characteristics. So characteristics, a restlessness at the beginning of the chill in a fever, that is very characteristics.
Restlessness at the beginning of the chill, that is very correct. During heat, restlessness during heat, during menses. Restlessness not in other times, during menses. It has no relation with the pathology. It has no relation with the particular circumstance in any way. By pathology or a practice of medicine cannot explain these one. These are related to the patient as a whole. So these mental symptoms are to be taken into consideration in the selection of medicine or to making the totality. So how this your symptom, and from which part of the symptom, which part of the patient the symptoms are coming. There are so many category of mental symptoms. You see, we have the different layer or stair of mind. One is that is the will, and that is intellect, and the understanding, emotions. So these are different level of the function of the mind. So in that case, again, we have to evaluate the individual symptoms from which level it is coming. We have Dr. Kent and the other stalwarts. They have given maximum importance to the symptoms arising out of the will. That is desire. I like this. I don't like this. I hate this. So these are coming from the will, the traits of the will or the traits of the particular individual. It reflects the inner nature of the individual. That's why they are given maximum importance. Next, the emotions. Love, emotion, different emotions. That is sorrow, joy. Then your a number of emotional symptoms are there. If we go through the mathematical as well as so, emotional symptoms are to be taken into next. Next, the intellect, the memory, intellect memory, receives and recall. So memory come to the third position of the mental state. So, so when we are taking the cases, in a particular of a particular patient, we have to consider definitely the mental state along with the physical state, and technically we have to observe. Technically, definitely we have to observe using our senses, 5 senses, using our senses as well as knowledge, deep knowledge, definitely knowledge of the medical sciences, and we have to collect all those symptoms. After that, we have to evaluate the individual mental symptoms. So where the mental symptoms are available, there we have to evaluate the symptoms in that way, from where it is coming, how it started, and which level and which category. Whether the common category, they are uncommon category. If it is uncommon, if they are striking, rare, or strange symptoms, that is the characteristics one, or they are appearing as, they are also characteristics, or they are appearing as positive, or this your that is called concomitants. So in that way, you have to study the patient, his mental state, as well as the symptoms which are collected from that, to make the totality and select a medicine. And we have to try for that. These characteristic symptoms, specifically the mental ones, must be given maximum importance or more weightage to the comparing with the physical symptoms. But where the mental symptoms are not available, Even the expert cannot get in. It is not that every patient will have the mental symptoms. Every patient, every disease will reflect through mind and body. It is not always. It is case to case. It is different. There are innumerable varieties of these your cases. Similarly, we have also different types of medicines where the symptoms are only in the physical level, in the pathological level. In medicines, there are medicines where we will get the mental symptoms as well as physical symptoms, and there are medicines where we are getting dominating mental symptoms as naxmomica, as nitric acid, as camomilla, as sina, as natramure, as sepia, as silesia, as gelsemium. They are the dominating. Then argentum nitricum, lycopodium, they are the dominating issue of mental state. Stramonium, hyoscyamus, they are dominating mental state. So even there are some other medicines, belladonna, aconite, they are definitely this dominating mental state. Again, these mental state, I was telling you about the related, how far it is related to the pathology. A restlessness of aconite and a restlessness of arsenic. A patient suddenly this year exposed to some external factor and started this year fever, headache, etc. And he may have the restlessness, but in that restlessness, never anxiety and restlessness never reflected in the arsenic. Arsenic always related to the pathological state, the zymotic state, where the patient is in the grave state, or extension of the pathology, or the septic condition is much more advanced. In that state, if you get the this your restlessness. So association of particular mental symptom with the pathology also or to be judged, it is also very necessary to understand as well as this your categorize. So these are very important in the searching or selection of medicine of a patient through mentals. Though I am telling you the only mental symptoms are not sufficient to make the totality, where the physical symptoms are equally available. So we have to select such a medicine which have the similarity both with the mental as well as the physical symptoms of the patient, and where we have though definitely there we must give more importance to the mental characteristics, and where the dominating mental symptoms with the patient, we have to select a medicine where this your dominating mental symptoms. Just like chamomilla never be used in a mild patient. Sina never be used in a mild patient. Naxmomica is like that. Pulsatile never be used in an irritable or this your this patients. So netramio or ignacia. So they are having the definite stage, definite relation with the pathology, different this your relation with the specific disease state of the patient. So it is simply I am getting the particular mental symptoms, and I can select a particular medicine. Through that, it is difficult. You have to correlate the each and every symptoms with the present state. So that is logically is there to be co linked. They are to be placed so that it can draw a definite portrait of the disease. Portrait of the disease. That means it must have a specific identification. Just like Rabindranath, Charlie Chaplin or that Subhash Chandra, they are having this specific outline in their picture, so they can be identified specifically. And similarly, each and every disease state can be identified by its peculiar outlines. That means peculiar symptoms, whether it is in the mental level or in the physical level. So mental level symptoms are, they are always, they are your general symptoms, as well as they reflect the internal man, that is the deranged vital force. That's why they are given much more importance than the physical generals, where the both of the peculiar and common symptoms are there, both at the level of physical as well as mental level. So mental must be the medicine selected that must contain mental symptom at least. So that is the way of evaluating the mental symptoms uh, as a whole in a patient. So collection, definitely collection of symptom is different. A genius must have the knowledge how to collect, how to observe, how to analyze the symptoms, and how to place them in the totality, or where to place to make it the portrait of the disease in a particular patient. So that is the I so far I understood about the topic, that evaluating the mental symptoms of the patient. By that we can manage whether it is a curable one or it is a palliative one. If it is possible, even mental symptoms are sometimes guide to select a medicine for palliation of the cases. So
Thank you, Panna sir.
query, Dr. Mukherjee
Thank you,
and
Panna
others,
sir. There is a
those who are in
question.
the
Thank you, Panna sir. There is a question
video
from Probir Mujumdar.
program, I may
Uh,
request any query.
Thank you, Panna sir. Can you hear
Hello,
me, sir? There is a question from Probir
Dr.
Mujumdar.
Mukherjee, you are, Bidyut, you are not audible.
Uh, Hello.
Hello,
Orko, can you hear me?
hello, not
There is a
audible,
question on the screen. There is a question on the screen now.
not audible, not audible.
There is a question on the screen. There is a question on the screen.
Yes, yes.
Hello.
Yes, I have seen it.
There is a question on the screen.
Yes. Yes, I have seen it, but it is not known to me. Actually, the ISD and DSM, these are all, it is unknown to me.
Uh,
And then
Kalyani sir.
I can. Yes.
Kalyani sir. Panna sir had got disconnected.
আমাকে শুনতে পেয়েছিলে?
ICD actually is a international classification of disease.
I have seen,
ICD again is used to translate diagnosis of disease and other health problems from words as described. Actually, it's a coding. We had a CME, Dr. Prabir Majumdar. We had a CME on the coding, and a huge quantum of our homeopathic physicians are not aware of the coding system at the present. We used to deal with the symptom similarity, and we try to analyze the case and give it. But there are certain physical manuals like ICD, DSM. So ICD is a coding system, and DSM is the diagnostic and statistics manual of the mental disorders. It's mostly used for psychiatry and to diagnose the psychiatric cases. But here, at the present scenario, we are dealing with the mental symptoms, but not with the psychiatric cases or to certify them as it is termed. So, by the present scenario that we are going for an integrated therapy as the government of India is going through. So we need help from each other. We homeopaths can refer the patient for a psychiatric counseling session or to the psychiatrist. and the psychiatrist in turn can refer back the patient to our homeopathic therapy with his diagnostic inputs. Over to you, Kalyani sir, for your thoughts on this. I think Dr. Prabir Majumdar, your question has not been answered fully, but we'll try to have this coding and its interpretation with the mental disease as per Hahnemann's organon of medicine. We will be definitely trying to interlink both of them in our upcoming CMEs. Over to you, Kalyani sir.
Thank you, Dr. Bidyut Mukherjee. Thanks to our today's inaugurator, Dr. Austin Jones, for nicely inaugurating the program. We are really thankful to our two senior brothers, Professor Dr. Pannalal and Dr. Krishna Mukherjee, for giving their experiences. Nicely, our today's speaker, brilliant speaker, Krishna Mukherjee, has presented few cases with its explanation, really presentable cases. Professor Day has beautifully explained the evaluation of mental symptoms. As we all know that evaluation of symptoms is a great chapter in homeopathic system medicine. Equally, evaluation of mental symptoms is such an important. It has been nicely explained by Professor Pannalal. We are really thankful and grateful to him for giving this immense experience and knowledge. See, in our case setting, what we do from first line, starting from the name up till mental symptom, all is, as Dr. Day told, it is external man, the patient externally. Patient gives first preference to the first chapter, that is present complaints. He is troubled, disturbances from which he wants to get rid of it. But our first preference usually become for the inner person, the mind, identical, specific, individualistic person, both combination with mental and physical symptom. And we look more towards the inner person to assess the specific individualistic personality. So anyway, we have learned enough, and presently, especially NI strength of prescription is more on Kentian basis than of Bonihosian or other basis. But we cannot ignore any of the systems, any of the repertories, any of the steps according to cases. Moreover, we have learned today from the speakers of the day and the moderator that most important is mental observation than mental correction. This is another very good information. We correct mental symptoms very seriously, but sometimes we ignore observation, which is very, very important. Sometimes we have observed, we have experienced that a single observation makes the complete picture. Either positive mentality is inherent, not been expected by the patient, or some other factors where these observatory mental symptoms become the only guideline of the case. The rest of the physical and mental symptoms are secondary to that case, as we have seen. I can give you a few examples of my teacher. I once told Professor Dr. A.S. Chatterjee in Calcutta Homeopathy Medical College. He was an eye surgeon. I told you in other CV this case, one patient came, a woman, complained that I have become blind since yesterday morning. Suddenly, when I was cleaning my lobby at village, Dr. Chatterjee becomes stunned. From tomorrow morning, he told, he asked the patient to wait to sit in a side of the eye department of Calcutta Homeopathy Medical College. She was sitting by the side of the table, and Dr. Chatterjee was seeing the cases, and instantly he was observing the patient. After completion of the whole OPD at about 1:10, 1:30, suddenly he asked her, আচ্ছা বলো তো তোমাদের একটা ওষুধ আছে না সব উল্টো উল্টো হয় very language in Bengali. I'm telling in English. Can you tell me there is one drug in your system of medicine homeopathy where everything is exactly reverse of its expectation? Then immediately, sir, it is ignition. Yes, yes, yes. Give her ignition. Which potency? That I don't know. That is your decision. So we then thought, ignition is a mental symptom. Let it be given a little bit higher potency. 200, with his permission was given to the patient. Patient went back to collect the medicine from the dispensary. Then you ask her, "Sir, how you are telling that ulto exactly reverse of expectation, which is mentioned in our medicine ignatia." Then he told, "Have you not observed that this patient who has become blind since yesterday morning is playing with paperweight on the table in OPD of eye department? Is it normal?" She was supposed to be very anxious, tense, supposed to be carried by some other people's sudden blindness. Entire life is lost. How she can play with a paperweight? At that time, round paperweight was available in our OPD. We were astonished. All along we were sick with him, but none of us observed that the woman was playing with paperweight on the table for hours together. The surprising piece is not ends here. Next, after next a week, on the same day, when Dr. Chatterjee was entering the hospital gate, we about 7, 8 junior doctors are waiting in the gate to welcome him. "Sir, that blind patient has started seeing, and he has brought a number of patients from platforms of Sialda railway stations in Sialda." Then he asked, "What has happened?" That woman to whom you asked us to give the medicine which has exactly reverse symptom, Ignatia 200, she has collected many blinds from station, platform, trains, and his villages. All they have collected and took them in our OPD. They are waiting for me. Then Dr. Chatterjee told, "Then I am going back to my home." By our request, he came in the OPD and by folded hand before the patient, all the blind patients, he told, "See, this was his good luck. I cannot remember exactly the diagnosis. That was and sudden acute incidence of blindness due to some bleeding or retinal detachments. Incidentally, it has got cured. All blinds can never be cured. We can try our level best. If you are quiet, calm, and give us chance to try, then we can try." This was one incidence of mental observation. Another case of my teacher, Dr. T.P. Mundal. One gastric ulcer was admitted under his guidance. Every day we are going to him. For months together, he was given different types of medicine. At that time, pentavalent group of drugs and gastric ulcer was not easily curable. It was a troublesome disease. Patient had severe pain, regular, tremendous pain whenever he is eating something, becoming emaciated like anything. Every day, Dr. T.P. Mondal, along with us, going to the patient. Patient is telling, "Sir, no relief, tremendous pain, I cannot tolerate." But before telling his complaint, whenever Dr. Mondal enters or goes to his bed, immediately he will come down from the bed. This was a regular routine procedure. He will touch the feet of Dr. Mondal and he will put this pranam to his head and used to tell, "Sir, আপনি আমাকে ভালো করে দিন. Sir, please cure me." No relief by any medicine. After a long period, more than 1.5 months, suddenly we found one day that patient is not in the bed. Dr. Mundal alleged her by seeing other patients. She was coming down from second floor to first floor. Second floor was a male ward. When he was coming down, in the middle of the staircase, suddenly the patient started, "Sir, sir, 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 please wait." In Bengali, "Sir, sir, একটু দাঁড়ান স্যার, আমি একটু প্রণাম করেন, প্রণাম করব." He was bare bodied. He was taking bath, went to the toilet, bare bodied and wearing a minimum dress. He was running to pranam to the sir as his regular routine. He just, after coming in the bed, he heard that sir came and he's going back. So when he pranam, then T.P. Mondal suddenly stopped. Then he told, "Chalo, chalo, upre chalo, upre chalo. Let us go upstairs again." He went back to his bed, took the case records, and mentioned acid nitric 201 dose. We are surprised. Then we asked Dr. Mondal. Usually our teachers' nature was, they will not immediately tell you the drugs. They will ask you to think why the drug has been given and wait for the improvement. We are waiting. Surprisingly, we found from the next day, gradually patients started improving. Gradual improvement by acid nitrate 200. Then we asked her, we tried our level-based recase taking by multiple students, but none of us could came to the conclusion why it is acid nitric and is getting relief after a long period. Then he asked the patient, take off your banyan, shorts and banyan. Let me see the back. He took off the dress. We found some scar marks. By that time we studied jurisprudence, but we are not that much expert. Then sir asked, are these scar marks are pathological, physiological, or judicial? We were astonished. We are all kept mum. Then sir told, it is judicial karma, criminal karma, direction of these scars from above downwards in a specific direction, linewards direction. Then sir asked, তোমার পিঠের দাগগুলো কি করে হলো? How the scar marks or the marks in the back happened? Then the patient is telling, that I don't know. In child life, I was very much naughty. Maybe while I was playing, something has happened. Sir told that after coming back from the patient, he is a very much serious criminal. He had some criminal dragging for any reason. That is why this type of scar mark. He is doing pronouns mean he wants to subside his original basic mentality. He wants to show dramatically he is very much obedient, gentle, nice, and godly reverse. And very much nice person. But practically he is exactly reverse. That is why nitric acid was given and the drug is giving improvement. So this was the observation by scar mark of the back. Entire mental picture was clear. He told, is it very normal that every day one patient will come down from the bed without getting improvement and he will run to his doctor regularly? This was one observation, what I have seen. I can tell you three examples in my nice life. All were published in literature. First case was Namaste, that was published in Ellen's journal, Ellen's laboratory. A military patient, ex-military person, he came to the OPD with urinary black, suprapubic accreditation, very high blood sugar, uncontrolled blood sugar, and fluctuable, somehow controlled hypertension, who was refused to operate prostate from Command Hospital RDP and was asked the patient to continue medicines, injection, etc. Until the sugar and pressure being controlled, he cannot be operated. Listening all these things, by hearing from some person, he came to the Amasti Ram OPD. And incidentally, he became my case. So I immediately got the chance for learning. I asked the patient, can you get admission? Then he agreed immediately. He came with his son. He agreed. We are observing. From our teacher in Calcutta Homeopathy College, we learned that whenever you find a critical, refused or obstinate type of case, do not prescribe immediately. Make your decision confirmed by repeated observation, repeated case taking, repeated searching, and searching. Get it confirmed, especially by mental symptoms, then prescribe. Because once your bullet is out of your hand, if peripheral symptoms are cut off, the original stream, nature of the plant will be off from your brain and eyes. That practice I used to give in placebo and observing, no change. You are lying in the bed, regular reporting, no change. What I observed, from coming in the OPD, till 4-5 days, patient is completely quiet, no tension, no repetition of his complaints, no request, as if a completely perfect person is lying on the bed. Every day I am asking, how are you? ডাক্তারবাবু ভালো আছে। আপনার পেটের কষ্ট একই রকম আছে, no change. Then seeing this indifference, which was taught by our teachers, that indifference regarding outward world is sepia, indifference regarding internal persons are arbitrary, having no concern with his body and mind. That struck to my mind that how a military person having such type of service nature, so sporting and strong and stout, being refused from the command hospital like hospital for operation. Operation is the only way out. Such type of disease, uncontrolled sugar and hypertension, how he can be quiet in such a manner for days together. They asked his son who is to come to see him that if your father is of that nature, he told, not only after retirement, since I can remember, my father is that type of person. He is very indifferent regarding his own sufferings and others. Never complains to anybody. Until doctors ask questions, until we chase him, he never tell anybody he's suffering. Arnica 200 was prescribed, and I advised, I asked, requested Professor B.R. Mukherjee, you might be knowing, those who are dependent, and Dr. Gopal Dave to see the case and help me to learn something. Both of them very sincerely. Them, they observed, regularly they were observing the patient and telling me, you tried, patient is stable, patient is stable. Blood sugar and blood pressure intermittently being checked, everything is stable. With the allopathic medicines he was taking before. One morning, suddenly, early morning, sister, I cannot remember his name, probably Minotiji, something like that. He came to your Baranda hostel or deeper students know behind the main building. Baranda that Dr. Kalyani, please come, that patient has taken off the catheter. Then I ran to the patient and I found blood and urine are coming through the suprapubic systemic area. Catheter is out of his abdomen. Then immediately I ran to Dr. Gopal Dave, who is to stay in Marwari Hospital quarters. Then I told sir, this has happened. What to do? Then Dr. Dave told what has happened. It is okay. Again, you have to be given catheter. You wait, I am coming. He came within an hour and he told, patient is passing urine, blood is all right. You wait and observe. Another suprapubic system is necessary. Then I asked Dr. Dave, can we wait for 1 to 2 days? Because patient replied, in the midnight I do not know how I had taken out the catheter. In the midnight there was itching in my abdomen. Then I do not know. Sister told, you are eating seriously. Suddenly he dragged the catheter out with the ball ligament. The opening was widened. Then urine started flowing through the suprapubic open area. Bleeding stopped, fast stopped, ulcer started reducing. By the inspiration and encouragement of Dr. B.R. Mukherjee and Gopal Dave, I was very much inspired. They told, go on, continue your medicine. Don't stop it. Patient is improving. Quantity of urine started coming down from your suprapubic system. And incidentally, urine started coming through normal urethral passage. Through both the passage, normal passage and suprapubic system area, patient is passing urine involuntarily. Continued the medicine means placebo, placebo, placebo. About 4-5 days, gradually opening becomes smaller, smaller and smaller, ultimately close. Completely involuntary urination through urethra was started. Dr. Dave, when he found that involuntary urination through urethra, he introduced one simple catheter through urethra and patient was passing from that urethra. After a few 4-5 days, when opening gradually completely healed up, with a rawness, Dr. Dave take off the catheter and asked me to observe what happens. Fortunately, we started observing that patient passing urination through urethra with voluntary control, to little bit. Within another few days, patient starting completely voluntary urination as per his will. He was discharged from the hospital and Dr. Dave told me, you ask the patient to come every 15 days and get your blood test, blood sugar and pressure tested. He used to come with his son every 15 days. Gradually, open wound which was built up and was raw gradually became blackened, means the thing is healing. Patient is passing urine normally. Then Dr. B.R. Mukherjee and Gopal Latu one day took him to the OPD, operation theater in our first floor of the United building, and they found that there is one great big fibrosis. Bladder and the wall of the abdomen has become fixed by fibrosis. Then they told patient needs another operation because it has been adjoined abdominal wall and urinary bladder. It is difficult to get release from this complaint. He have to be operated. Again, I asked her, can you wait for a few more days? Look, you observe. Then I started giving Hylucia 30 potency, a very minimum dose, with the conception that if there is fibrosis happened recently, cannot be dissolved by dialysis as it is given in the literature. You will be surprised to know it took a long time to see that. Gradually, the bladder becomes detached from the abdominal wall. The abdominal wall was free from the bladder. There was no attachment, no lump. Urine passes voluntarily, completely normal patient. So this was arnica indifferently internally. Another two cases was published in a Honb'le when we are having thyroid research project. One patient was taken in our OPD with few women. He was completely lusterless, trembling like anything. When I touched his body, flushing of it, complete exophthalmos with violent crisis, which is called as great disease. We got a chance, immediately admitted. On the same day, patient was admitted. After admission, when the patient party were there, I asked who is, when there was a chance of signature, then some neighboring person was signed. Then it was objective. I called everybody. Then I told, where is his guardian, her guardian? Then the party told that his guardian husband hasn't come. Why? Sir, there are many stories. He is a very good woman that we have taken that patient to hospital because he is going to die. How? Now he wants to suicide because nobody is there to look after him, even his husband, even her husband. I admitted the patient and I found that the patient is with all the complaints, tremors, violence, pressure is high. The patient is lying on the bed, calm and quietly, without any anxiety, without any restlessness. Then, incidentally, I got desire for salt. With neglected mother, definitely he might have shock or persistent strain. Thyroid function has been disturbed. By getting the desire for salt, prescription was nectarine, and it was published in Inaugurator. Within few days, first tremor came down, then laughter of the patient started improving, then blood pressure became stable, flushings of heat came down, started gradually improving. After 3 weeks, he was discharged from the hospital. Then after another 15 days, patient reported in the hospital. He was nice looking, properly wear everything. Then you ask her directly the question, are you happy with family, those who are not observing you? The reply was, I don't care them. I will live of my own. See the effect of homeopathy medicine. Not only physical complaints went off, but the mental confidence of the patient that I will survive on my own. I don't care anybody, neither my husband nor anybody. This type of confidence by nature, it can happen in homeopathy family. We have seen. Another case of OPD. For 2.5 years, I was treating the patient of hyperthyroidism, going through all the symptoms of hyperthyroidism with no result. Same, no complaint. But maybe for the behavior or for the hospital structure, patient used to come, used to stay in the other nearby patient. I was every time trying, every time failing. After 2.5 years, suddenly, you might be knowing her, those who are present students, luckily there is one attending your PD. Luckily came and told when the patient left my cubicle, sir, don't see this patient. Why? He's coming for 2.5 years without any change. So much affection for homeopathy. But you do not know, sir, what type of woman he is. Every day he's creating complaints in either in the counter, registration counter, or in the dispensary. Every day he will shout, quarrel, and make chaos in either dispensary or in the registration counter. With the other patients, with the employees, with the attendants. We know all of her. Nobody wants to help her. Such type of not human he is. See, by 2.5 years, I could not find out the symptom of observation of of you attending, there is basically very much concern. Without thinking anything, I started. And the magic started. Gradually, blood pressure started coming down. Patients started improving in all senses, all complaints. Not only that, patients started gaining weight. I have the photography which was published in Bulletin before and after. Complete change by simply lattice 200. See the beauty by 2.5 years sitting in the cubicle. A night patients are exposed to the cubicles, not very much confined or closed. We are not able to observe his induced or purchases core latitude. So, dear brothers and sisters, in homeopathic system of medicine, you must agree that Indian system has become more successful because in the world, this Bengal, especially Calcutta homeopathic practice system, is more prominent, more long in period, and more experienced. Maybe because of this Indian type of practice. See the internal person. If there is nothing, then consider the external person. If you find mental symptom, external, internal person, that will be the best guideline, and many times you will see the miracles. So many of you have many experiences, especially what I do, learning all these things, by seeing all these things. Whenever I conclude a case, this has become my habit. I will ask a direct question which is asked not to do. I use direct question on mind. If the patient says yes, I immediately prescribe the same medicine because I become confident that my medicine is going to definitely work. Not only that, patient feels, many patients have told, sir, you are Bhagavan, you are God. How could you know that I am of that nature? I have such type of nature because patient do not know. Patient is thinking that I am some astrologer or some other quality I have. But the thing is that I correct the totality, I evaluate, I select few drugs. Then from the few drugs, as it has been told our literature, I make it conform by asking direct mental questions. And I have seen, you can also observe and experience that confirmation by mental symptoms are very much confidential prescription, sorry, confirmatory prescription. You will see the miracles. So as we have come today in the seminar, evaluation for mental symptom is very, very important for obstinate clinical cases, which you start practicing every day for every patient, especially diffuse, critical, and chronic cases. We thank you, thanks to all. It is too late today. I'm very sorry. I could not restrain myself to give this experience. So anyway, many thanks to the persons, brilliant person in the field, on the field, and we will see this video later on. Observers and viewers, everybody, many thanks. Thank you very much, Bidyut. Please.
Thank
Bidyut,
you
you have become
all
muted.
our seniors. Yes, sir. To all our seniors, our learned speakers, moderators, inaugurator, and it's a learning platform. We share our experiences to enrich each others, and these are kept in the YouTube as in the archive, and we can replay, and get all these experiences for our lifetime. So there is another announcement from on behalf of the Alumni Association that in between we had lost few of our junior alumnus who happen to be very close to our heart, and with all of deep sorrow. It's some painful moments for all the alumni across the country and the globe. Losing somebody is very painful, but before losing, it's our honest request to all the alumni, whoever in touch, please make this networking strong. Share and spread the word of the Alumni Association through CME, through online journal, through our website, through our WhatsApp group interaction. We are trying to connect each other. So just spread the word. Losing somebody and giving lot of RIP, we feel sorrow is not that. We need to be interconnected. We have with us tonight, we had with us our respected Pannalal sir, senior most pro, all the three, our president Kalyani sir, a learned person, then Dr. Krishna Sudam Mukherjee, and the alumni producers. We had the inaugurator, Dr. Astin Jose, the Deputy Medical Superintendent of NIH. So let's have our network strong. Those who are seeing this live and who will be seeing the telecast later on, please spread the word that there is a alumni association of National Institute of Homeopathy who are trying to connect, reach out to all the ex-students of NIH. The courses were DIP NIH, the undergraduate BHMS started in 87 and continuing with the 33rd batch now to get admitted. The postgraduate course started in 99 and the probably the 22nd, 23rd batch is going to be or 24th batch is going to be admitted. So three courses, and in the future, the satellite unit of NIH in Delhi are going to start PhD as well as continue with the MD courses once the affiliation process is on and completed. So it's an earnest request to all who are hearing our voice, please spread the word and make this networking strong. With this and with the permission of Kalyani sir, I am returning back to our backstage editor, Orko. Good night, take care, stay safe, and we'll be meeting again on 26th of February with another set of speakers and excellent topic. Over to you, Orko.
Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME and means gained some knowledge about today's topic. And so, with this, it comes to an end, and we will meet you on our next CME. Until then, if you want to get updated about anything related NIH alumni and also get notified about the upcoming CMEs, do make sure to subscribe this channel, follow us on Instagram and Twitter, like our Facebook page so as to get updated as soon as we schedule a CME. And also, there is a join button. You can just join as a member if you want to. It will help our channel to grow for some instance. So, with this, it's night and leaving to all of you. Thank you to all the teachers for joining with us, and thank you seniors and other juniors who are watching this video live and in a recorded version. So with this, it's me, Orko Mukherjee, leaving. Good night, all.